Are you one of the millions of Americans who are always tired? Well, if you're like most people, you probably assume that your fatigue is the result of a hectic lifestyle. But what if it's the sign of a serious health problem? Bradenton Cardiology Center and Daytime's resident doctor, Srini Iyengar, is here to tell us how to tell how tired is too tired. I'm just tired in general.
Well, see, this is a very common scenario. People always complain saying, hey, I just don't have the energy that I used to have. So when do you differentiate between normal and pathologic with fatigue? So times we tell patients are, if you've had your fatigue on for more than 2-3 weeks and there's been really substantial changes in your day-to-day activities, that's when it's time to see a professional.
That's when it's abnormal fatigue.
Exactly. 2 to 3 weeks without changing your daily lifestyle schedule. Like if you're not running marathons, if you're not doing something that's excessively changing your lifestyle pattern, like if you're working late nights, that would be something that may explain the excessive fatigue. Otherwise, yeah, you should see someone about that.
Okay, and when we look at different things that can cause excessive fatigue, the list is a long one.
The list is a long one, and this is the thing is, but it's probably one of the most common complaints we see. You know, when patients come in, especially women, they'll say, I just have a lot more tiredness, lethargy, fatigue. I just don't feel like myself anymore. What else could be going on? A lot of time, the common response is, well, is it stress?
Right.
Is it anxiety? Is there something, depression? But before we use those, should we say, etiologies to explain what's going on, we should rule out some other common things that may be occurring.
Okay, before we get into more of the stress and anxiety, what are some of the other things that we should rule out?
Well, especially with women, anemia, losing blood, those are things that can cause people to feel tired and lethargic and fatigued.
During their monthly cycle.
Exactly. Also, thyroid dysfunction. Millions of Americans, many of them women, suffer from hypothyroidism. Your thyroid gland produces a lot of the hormones which regulate your metabolism and your energy levels. And one of the big things that I've really found a lot of patients have is something called sleep apnea, where people say, hey, I sleep 8 hours a night. Why do I feel so tired during the day?
Because you're snoring.
Because you're snoring, exactly. If you're not getting quality sleep, doesn't matter the quantity.
So is it the same thing with talking in your sleep?
Potentially, depends what you're saying. No, but
that's a very good point. Okay, now let's get back to anxiety and how that can cause excessive fatigue.
It does. Anxiety and stress, these are very common, especially in the American workplace. People are under constant stress right now, especially with the current economic climate.
Right.
People are working harder, longer, or just trying to maintain what they have. And that can end up being more anxiety-related issues at night, not giving you enough sleep, because a lot of people say, I go to sleep, but I can't close my eyes because all I think about it is the stress during the day. And that will eat away at your life.
Right, and it eats away, yeah, it eats away at so many more things in your health,
exactly.
Long-term as well.
Your cardiovascular system is dependent on a healthy systemic well-being. If you have no sleep or if you have constant stress, the hormones in your body build up over time, like cortisol and these stress hormones, and they end up having really negative effects over the long term.
Okay, when you're talking about negative effects over the long term, what kind of a negative effects? Because my whole thing is a good night of sleep can cure almost anything, almost, relatively speaking. It can help your body a lot. It
can definitely make a huge difference. Those stress hormones that we describe are the ones that are there for emergencies. They're not there for a chronic, constant basis. Over time, they could lead to immune deficiency in your body. You'll be more prone to picking up infections. If you have a history of any heart disease or prone to it, it can make the process accelerate. So there's other things that stress hormones can do that are negative. It's good to have them in certain situations, but not from a long-term chronic issue like lack of sleep.
What about people who say, I just can't get the time? I just can't find the time to sleep 8 hours a night.
Well, there's something to be said to that, but you're going to have to make time, because eventually that rat race you're running is going to catch up to you, and you're going to be paying it down the line, and someone's going to suffer, not just you, maybe your family members, because you can't take care of them the way you want to.
Very good point, because there's a lot of other people probably in your life that need you and
that
care
are depending
about
on you. Exactly.
Absolutely, that's absolutely true. All right, well, listen, if we want to get, what, 6 to 8 hours a night, that's pretty good?
Well, I would say 6 to 8 quality, though.
Quality.
Remember, the quantity isn't as important if you're not getting good quality. So you
see your health specialist
if you're having any of these issues. And remember, we said anemia, hypothyroidism, these are things to be worked up before we say it's an anxiety, stress, or depression issue.
Okay, so take some tests.
Exactly.
A lot of tests can be taken too. All right, you can find out more about our resident doctor, Dr. Iyengar, by visiting daytimeonline.tv. Just click on his handsome head there. We'll be right back with more.